You'd think after a year of this, we would be able to hang a Zoom, but no, my Zoom skills are degrading as the time sort of progresses. All right, so this is the Governance and Management Research Speaker Series at O'Neill School, so thank you very much for attending today. Our speaker today is Dr. Elizabeth Linos, the University of California, Berkeley. And a quick programming note, we're going to have 3 more speaker series events for the governance and management faculty the remainder of this semester. March 26th, here in a couple of weeks, we'll have Mildred Warner from Cornell. On April 9th, we're going to have kind of a double team with Gregory Porembescu and Suzanne Petrowski from Rutgers. And then April 23rd, Andrea Headley from the McCourt School at Georgetown. And as we have more information on their presentations, I'll send those out and share those. So our speaker today, Professor Linos, is a behavioral scientist and public management scholar. Her work primarily focuses on how to improve government by focusing on its people. Specifically, her studies consider how we can improve diversity in recruitment and selection, how to reduce burnout at work, and how different work environments affect performance and motivation in government. She's published in a wide range of journals, academic outlets, from JPART and PAR to the British Medical Journal. She's appeared all over in media, including Harvard Business Review, The Economist, Governing Magazine, and Slate. And she is a former VP and head of research and evaluation with Behavioral Insights in North America, where she worked with government agencies in the US and the UK, which is a really cool outfit that has done a lot of groundbreaking work. And as she just mentioned a minute ago, being a native of Greece, she also was a policy advisor for the Greek Prime Minister, focusing on social innovation and public sector reform. So I will now stop sharing and allow Professor Linos to take the stage.
Thank you.
Anyway.
Thank you. And thank you all for coming. And thank you, Aaron, for the invite. Let me, as Aaron said, I think all our skills on Zoom have gone down the drain, but I think I'll be able to share my screen. Are you seeing the right version of my screen? Not the one with the notes. Okay, great. Well, I'm really excited to talk to you about a topic that feels too close to home for a lot of us these days, but it's something that I've been interested in even pre-pandemic. Before I do that, Aaron asked me to share a little bit about my research agenda, although your very kind introduction, Aaron, did most of this already. I'm happy to talk about my broader research agenda and Q&A as well, if this is of interest to you. But as Aaron mentioned, I think of my work as really at the intersection of public management and behavioral science, which means I think a lot about how we can improve government using insights from psychology and economics. And in particular, I spend a lot of my days thinking about how to recruit, retain, and support a diverse government workforce. The work that I'm going to show you today is really kind of in this bucket. But I've also spent quite a bit of time thinking about the interaction between residents and their government, and thinking about how we can improve that experience, which inevitably leads to projects around administrative burden and how we can reduce it. But because this is a relatively new field, and some of you may be interested in kind of behavioral public administration, as some people call it now, or nudges in government, as people called it in the olden days. I try to also take a step back in some of my projects and think about what the role is of behavioral science and nudge units and behavioral interventions in government. And I'm happy to talk about that. I think it's a important question to ask now, because the idea of using behavioral science in government has really exploded. And so now we have something like 250 teams across the world that look like BIT, where I used to work. And these are teams that are dedicated to using behavioral science specifically in government. So between those 3 areas, a lot of my work ends up being experimental. So today I'll tell you about the work in burnout, but happy to talk about any of these areas in Q&A if they are of interest. So the projects that I wanted to start talking about today start with a basic observation that if you've been feeling emotionally exhausted, if you've been feeling somewhat distant from your job or from the people that you interact with at work, and if you've been feeling like you just can't accomplish the things that you used to be able to accomplish, or that you just can't do the things that you should be able to do at work, you're not alone. So about 1 in 5 employees across the US experience burnout, and this is pre-pandemic. So about 20% of people reported being burnt out. Clearly, these rates have gone up quite a bit during this pandemic. But if you look at social workers and teachers and correctional officers and all the people that we depend on the front line to deliver services, the rates are much higher. So even pre-pandemic, 1 in 2 frontline workers report being burnt out. And so this in itself, to me, is a really important public sector crisis that we need to be spending more time with. Now, we know that burnout is costly in a bunch of different ways. So at the individual level, there's been a lot of research that looks at how burnout is associated with sickness and sleep problems and diabetes and coronary heart disease. But for those of us who study organizations, there's also quite a bit of evidence that burnout is linked to things like sick leave and turnover. There's some evidence that's starting to appear that shows relationships between burnout and service delivery. So things like more burnt out health workers making more medical mistakes or being less likely to wash their hands. And all of this looks like it's very costly for kind of society as a whole. So some estimates suggest that just on the kind of healthcare side, the cost of burnout for the US healthcare system is about $190 billion annually. So what's interesting is we've been studying this for a really long time. There's about 4 decades of good research looking at the antecedents of burnout and describing kind of the size of this problem, but we still have quite limited causal evidence on how to reduce it. So my work really started with this question, which is, okay, what are we going to do about it within the public sector, or what tools do we have available to address employee burnout, in particular frontline worker burnout in the public sector, within the confines that we all know and love of public sector resources and staff availability. So a quick preview of what I want to share with you today. First, I'll give you some results from a survey study that we've done during COVID that looks at predictors of burnout, and this is with Brenda Skibura, who's a fantastic PhD student. The purpose of this is just to quickly describe where we are on burnout during this period, and also introduce this idea of social support, which I'm going to talk to you a lot about in today's presentation. I'll spend most of my time sharing results from a field experiment where we try to use or leverage social support to actually reduce burnout and turnover with 911 dispatchers. And this is work with Krista Ruffini and Stephanie Wilcoxon. And because it's always interesting to think about the exact mechanism, I'll also show you an online experiment that tries to get at whether the mechanism is what I think it is. But all of this is still ongoing work. We're thinking a lot about burnout in my team right now. So I'm really looking forward to getting your feedback. So to do all this, let me start us off with kind of a theoretical framework that many of you will be familiar with. So to think about kind of the role of burnout, I start with the job demands resources model that basically says, look, every job is going to have its risk factors for what causes burnout, but you can put them in these 2 large buckets. On the one hand, we have job demands. So these are the things, the parts of your work that require cognitive effort or emotional effort or even physical effort. So high caseloads, demanding interactions with clients, long hours. And there's a lot of evidence that that is correlated with job strain and exhaustion. But then on the other hand, we have job resources. So these are the parts of your job that are available to you to help you do your work. And this is a pretty large category of what counts as a job resource. So you'll see work on social support, which I'm going to focus on, autonomy, getting regular feedback, learning opportunities. And the argument that got me really into the space was this idea that even when job demands are really high, so even when we can't change the fundamentals of a job, giving people the right job resources can buffer against burnout by helping them cope with those high job demands. And so that's really kind of the focus of my interest in this space. And it turns out a lot of that work on buffering has focused on social support for a couple of reasons. So if you think about why so many teachers quit within their first few years of service, and you ask them, why did you quit? You've been training for a while. Why did you quit in your second year? Which is a very common phenomenon. They won't say it's because, well, first they'll say it's because I burnt out. That's for sure. And then when you say, why did you burn out? They won't say it's because I hated the kids. They'll say it's because I didn't have support to do my work. My principal didn't support me. I didn't have colleagues that supported me. And so this becomes a narrative around why people burn out that has become really strong in the burnout literature. And so there's a long line of literatures that works on social support and burnout. But what's interesting is that when you take a closer look at this literature, the results are actually mixed on whether or not social support does in fact predict burnout. And my understanding of the literature is actually the things that we usually associate with support, receive social support, getting either emotional help or getting actual help with your tasks, doesn't actually seem to predict mental health outcomes as well as we thought. So most of the evidence around received social support suggests either limited or negative or no real association with mental health. But the idea that you could have support if you needed it, so this idea of perceived social support, that you have someone to turn to should you need them, much more consistently predicts mental health outcomes. We can talk for days about why that's the way these results come out, but from my perspective, the interesting question is, okay, if it's not about actually giving people help or giving them kind of a shoulder to cry on when they're struggling, how can we actually manipulate perceived social support without changing received social support? And then of course, does that matter causally for the outcomes that we care about? It's perfectly reasonable to assume that increasing perceived social support is going to reduce burnout, but it's also plausible that people who are less burnt out are more able to perceive social support around them, right? So the causal direction can go in either way. There could be some third variable that causes both. But I'm going to start with a hypothesis that says, if we do in fact strengthen perceived social support, we're going to manage to reduce burnout and resignations. Let me take you to this first study that I mentioned. This is a study that we did in March and April of 2020. I used to describe it as the height of the COVID pandemic. That now sounds silly. It was the first height of the COVID pandemic, but we worked across a local government and a state agency that was focused on unemployment insurance and surveyed everyone. And so what's interesting about this is that, most of the work that we have around burnout is around social workers or around health workers. This is really a wide range of types of occupations. We measure a lot of things, but what I want to talk about today is measures of perceived social support. So we ask questions about whether or not you have someone to talk to at work about your day-to-day problems, whether or not you feel like you belong in public service, and whether or not you feel connected to your coworkers. And quite simply, we correlate that with all sorts of validated psychological distress measures, the GAD-7 on anxiety. We look at secondary trauma, and we look at job burnout. And I don't want to spend too much time on this, but the major finding that I want to highlight is first, the rates of burnout are very, very high, as you can imagine during the COVID pandemic, because these are people who are teleworking, these are people who are not frontline workers as well. But even during this crisis, there's a huge gap between people who feel like they have someone to turn to at work and people who don't. So on social support and connectedness, hopefully you can see this in the slide, you basically get double the rates of burnout. And again, this is just a correlation. If you look at people who do say that they have someone at work to talk to versus people who don't. And when you think about people who feel like they belong in public service, again, you see the same pattern. So people who feel like they're not sure if they belong report much, much higher rates of burnout. So I think this is interesting enough of a data point to dig in a little bit deeper and think about whether or not this is causal. So to start thinking about causality, I'm going to take you to a different study that tries to experimentally look at the question of burnout. So this is a project that we did in collaboration with the Behavioral Insights team that focused on 911 dispatchers. And I can spend all day talking about why 911 dispatchers are the unsung heroes of law enforcement. They're considered call center workers. So even though their job, as you know, is to pick up the phone every time someone calls 911, and so they're facing hundreds of calls of potentially traumatic experiences They have to manage their own emotions and the emotions of the call taker. Formally, they're not considered emergency responders. And so let's imagine there's a crisis in a city. God forbid there's a large shooting. The person who's picking up the phone and hearing about everyone's trauma has to go back to work the next day because they're a call center worker. The firefighter or the police officer that responds gets a ton of mental health services and additional support and days off. And so it's no wonder that 911 dispatchers face really high levels of burnout, absenteeism, and turnover, which is really kind of what the goals of this project were to look at. So really quickly, we ran a field experiment across 9 mid-sized cities that are listed here. Why 9 cities, you may ask? It's because turns out in most mid-sized cities, 911 dispatch centers are very small, so we're trying to get our N up. And the experiment was relatively simple. We were trying to create a way to increase the sense of perceived social support by creating an environment where dispatchers could share their experiences with each other in an anonymous format. And so the goals were to kind of build this sense of group identification or sense that they belong to a community of peers that not only can support each other if something happens, but really understand what everybody else is going through. So at a fundamental level, think of this as the equivalent of kind of the online Facebook groups that all of us join voluntarily. It's just a community of people that you don't necessarily know, but you feel like they kind of get you. And the way we did this is we sent emails for 6 weeks to the treatment group. Every week, participants were nudged to read and share stories with their peers, and I'll show you what those nudges look like. And then that took 6 weeks, as you can imagine. And then for 4 months post-intervention, we measured burnout, sick leave, and resignations using administrative data. So to give you a sense of what these nudges look like, they say things like, this week, tell me about a time that your coworker did something that was so great and saved someone's life. Or what advice would you give to a new recruit about what it's like on the job? And I'll come back to this question of advice, but it turns out people are much more willing to give advice to new recruits than to join a peer support program, even though those are identical. So every week, we're nudging them with one of these prompts. The kind of email around the prompt emphasizes this idea that other dispatchers know what you're going through, that new recruits need your advice and feedback about your real experiences, so share your stories. And then after the first week, each email also included an actual story from the previous week. So even if you never went to the website or participated yourself, in your inbox, you got a story that said somebody else wrote this about their experience before you got nudged again. And then in the lowest tech way possible, all of those stories and experiences went onto a web platform that looks like this. So if you wanted to, you could click and read other people's stories and experiences. I had some questions once about why I made it so ugly, and it was because we didn't know any better, not because of some deep behavioral kind of behavioral science component to it. So I'm going to jump to the results for the sake of time. But basically, we're looking at burnout using the Copenhagen Burnout Inventory at baseline, immediately after the email, so 6 weeks later, and then 4 months after that, so 6 months post baseline. And as you'll see, across the different components of the CBI, so work burnout, personal burnout, and client burnout, we see a significant reduction. Overall, this is about an 8-point reduction. And to give you a sense of what that means, that's about the difference between social workers on average and administrative staff on average. So it's a pretty sizable shift in burnout. And what's intriguing, at least from my perspective, is that we see it most strongly after 6 months. So that's relatively medium term, at least for most behavioral science experiments. If you like regressions, this is the regression format, but basically consistently we see this reduction in burnout 4 months after the end of the intervention. When we look at resignations, we see a similar pattern, and this is particularly interesting, and I'm happy to talk about it. Here again, the results are stronger post-intervention. And it looks like we halved turnover in the 6-month period. So given the fact that the intervention was essentially a zero cost intervention, this is a really significant return on investment in terms of turnover. And just to give you a sense of what the numbers look like in a regression, it's about a 3.5 percentage point change, essentially for no cost. We can talk about what that translates to. Depending on how you count the cost of turnover, it's something like $100,000 to $400,000 for a mid-sized city in terms of the cost of retaining these people instead of having to find new people. So we see these significant findings of this intervention on burnout. We see them on retention, but like with any field experiment, there's a lot of things going on, right? So we're sending people emails. The emails are coming from their supervisor. So it's possible that just receiving an email from your supervisor that says anything is actually what's causing the effect, right? Because now you feel like your supervisor cares about you or is paying attention to you in some way. Also, there's a large literature around advice giving and how asking people to give advice is actually good for the advice giver versus the advice receiver. And so there's other things that are happening, as is always the case when you have a field experiment. So we wanted to kind of take this idea of really focusing on the social support component and test it in an online experiment to see if we can at least get consistent findings with what we think the mechanism is. So that's what study 3 is. So this is really just saying, is the mechanism really what we think it is? And is it really about the perceived social support component? Or is it just getting regular emails or the fact that we ask people to share advice? So what we did here is we took as our treatment in this MTurk trial, we took one of the weeks essentially of the intervention. So it says, imagine a new recruit just started at your current workplace and tells you, I just got hired last week. I'm excited, but also nervous about fitting in. Do you have any suggestions for a newbie? How would you describe your office culture to a newbie? How do you and your coworkers support each other? So we're priming people quite explicitly to think about how they support each other and how they're connected to other people at work. In this case, the control group is also being asked to give advice. So for our control group, we're saying, imagine a friend's teenager starting a new school and tells you, I'm starting a new school next week. I'm excited but nervous. Do you have any suggestion? What advice would you give to this teenager for succeeding at their new school? So what we're trying to do here is keep the advice giving component and take out this idea of perceived social support or social belonging. There's no reason why you would feel that you are kind of belong to this group of teenagers. These are all full-time MTurk workers that are adults. So we're trying to kind of disentangle the advice component from the social support component. And what's fascinating is we then ask people very similar questions about whether they feel connected or whether they feel like they belong, the kinds of things that I showed you in study 1. And no matter what we ask, it seems that this treatment increases your belief that you belong at work. And if we take a second to think about it, that's kind of bizarre, right? We have no interaction with their coworkers. They're not actually interacting with their real coworkers. They're just giving advice about what it's like to go to work every day. But in doing so, they feel more connected. They feel like they belong. They feel like they have someone to talk to. And we have other questions about feeling valued at work and things like that that all match this pattern. So of course, this is not final proof that the mechanism is what we think it is, but at least it fits the direction that we expect, that there's something about this type of intervention that we ran in the field experiment that really strengthens people's sense that they belong and they're connected to their coworkers. And so where we are now is we think that belonging affirmation interventions like what I described reduce burnout among frontline workers and significantly reduce turnover. But this is just one first study in this space. We're now trying to replicate with larger samples and really get the mechanism right. And I'm happy to get your advice on how to do that or what you would want to see to nail the mechanism. But right now I have an experiment in the field with correctional officers, which is really interesting. I'm happy to share what we're learning in that space. But also we're planning a large study with nurses as well. What you'll find or what you may see is that I'm focusing always on the kind of government worker that feels undervalued or not seen by society. So oftentimes 911 dispatchers feel like they're not respected or valued by law enforcement. Rightly so, because sometimes police officers treat them really poorly. Same thing with correctional officers. Sometimes they feel misunderstood. And certainly nurses vis-a-vis kind of physicians often feel undervalued or ignored. And so I think this is going to be most effective in those settings, but it's an interesting question to see kind of how much this scales. Once we get that right, the next big question that I'm interested in, and I want to bring up in case it's interesting to any of you, is how that then affects decision-making. So the experiments that we have running in the field right now, and the one on nurses, is also going to be able to measure changes to decision-making and performance. You all know why it is so difficult to get good measures of performance and decision-making in the public sector. So any advice you have about where and how to do that well is more than welcome. But ultimately, I think if we decide that this is an area that public sector agencies should invest in, it's going to be because we show a link between investing in the workforce and actual public service delivery causally. We don't have a lot of that causal evidence yet. And then the third area that I'm interested in and would love your thoughts on are, what are we doing wrong that so many people are burning out so quickly? So I find it fascinating that even though we think of the public sector as a place where people go for job security, and oftentimes people stay for job security, there's this window early on in the first, usually 2 to 5 years of service, where 50% of social workers quit, 50% of teachers quit, 40% of correctional officers quit. There's something about how we are setting expectations about what it means to work in the public sector that doesn't seem to match what people are experiencing. Or I think my hypothesis is that there's a mismatch there in expectations. And given that Indiana is famous for kind of some of the richest literature on motivation and public service motivation and how that affects people's decisions on jobs, I thought I would put it out there as a question in case anyone has ideas, because I think it's just an interesting thing to think about if we're going to reduce burnout over time. So I will stop there. I've added my Twitter handle and email and my new labs website, which we're fixing right now. It's kind of a mess, but it's going to be great. Just to say, if you have any thoughts after today, I'm happy to be in touch with any and all of you.
Great, thank you very much. I think we have a few questions. Claudia, have you have your hand up? You're muted, Claudia.
Thank you, Elizabeth, for your presentation and accepting our invitation. Very nice topic. I have one clarification question and another one is a suggestion. The first one, when you mention about social support, is that really what you are trying to measure, or is that workplace support? Because I think that these are two different things. When I first read the abstract of your paper, I thought, oh, social support, it means more from the community support, you see? So I think what this is more specific is about workplace support and given also the manipulations that you use. Now, given that, I think that this workplace support is conditioned by who offers this workplace support. It is not the same for me that if a colleague says, oh, Claudia, you are burnout, let me help you. If one of my associate deans comes and says, hey, Claudia, we really care about you. We are concerned that you are feeling unhappy. What can we do? That would make a huge difference for me. Even if it comes from the person in the human resource office, also it matters in a different way, you see? So I think that this is contingent on who provides this workplace support.
Yeah, I think, Claudia, I think both of those points are really important. And you're right, I didn't clarify. What's interesting, when you look at the job demands resources kind of framework, social support means all sorts of things. Like if you just read a few of the papers, sometimes people mean a supportive spouse. Some people mean a supervisor who is supportive and gives feedback. And sometimes they mean you have a friend at work. And you're 100% right that those are very different mechanisms, even though many of those are associated with better mental health outcomes, potentially for different reasons.
Mhm.
You're right, and I should fix how I talk about my research. I'm more interested in workplace social support. So given kind of people's family life or communities constant, what can we do? What are the kinds of resources that we can change at work that could affect mental health outcomes? And so I'm focused on workplace social support. And then within that, exactly to your point, I'm particularly interested in looking at peer social support, but you are right that there's really good evidence that how your supervisor speaks to you, or how someone kind of, if we think about vertical social support and horizontal social support, I don't know if those are the right ways of thinking about it. Vertical social support can mean something very different than peer social support. I guess one reason I was excited about this type of work is that it is often, at least in my kind of early qualitative work that I do to just understand the public sector workers that I'm trying to, do studies on, oftentimes they've already given up on their leadership. So they're already saying things like, my sheriff doesn't understand me, or like the PD leadership thinks we're dispensable. And so that level of social support has already broken in some ways. And so maybe all we have is kind of peer social support. That doesn't mean that it's a really interesting question. And I think it's a great kind of next study to do the horse race between, what matters most to people, the vertical social support or the horizontal social support. But at least in these studies, I was focused a lot more on like creating the sense of social belonging or group identification that some professions have, right? So if you talk to police officers, I used to do a lot of work on police officers, they'll say things like, we bleed blue. Like, it doesn't matter if you haven't met another police officer, you feel like you're part of the same club, but not all public sector workers have that. So that's the kind of thing I was trying to create here. But I think it's a really interesting question to think about what's most important to a given potentially burnt out person, like the HR person saying we value you, or your boss saying we value what you do every day, versus having someone to talk to when things get rough.
And Elizabeth, another thing that also probably should be taken into account is the nature of work, because 911 dispatchers, I believe that they have very little time to interact with peers, because the work requires it just to be all the time in front of on the phone. While for other jobs, there are more opportunities for interactions. So more peer support might be likely in certain kind of jobs, but not in others because of the nature of work. Thank you very much.
That's a really good point. Thank you. I'm writing that down.
Excellent. All right. I have a question in the chat from Cynthia Barboza Wilkes, who is a doctoral student at USC joining us today. And she asks, is there a reason why the control in study 3 includes advice to teenagers rather than adults? Is it approximate the potential power dynamic between a new and old employee in the treatment? Question mark.
So if I'm understanding the question correctly, here's what we were trying to do. Oh, and tell me if you buy this. We were trying to find a way to give advice to someone that wouldn't, in itself, put you in a mindset of group identification with another group. So kind of to Claudia's point, I might feel some sort of connection to the people I work with. I might feel some sort of connection to other adults in my community, a neighbor, for example, or other mothers, or whatever kind of identity you wanna strengthen. So because our MTurk sample were adults that were full-time workers outside of MTurk, like have a regular job, a teenager going to a new school seemed as far from that, like someone who you probably don't feel some instant kind of peer connection with, that we could think of. So part of it was kind of the power dynamic, or at least feeling social distance from that person, to be able to really disentangle the advice giving from the group identification component of our intervention.
Excellent. Thank you. Cynthia, if you have any follow-ups, you can throw them back in the text or the chat. Thanks.
And I'm sorry, Aaron, I can't see the chat, so thank you for saying for raising those questions. I'm not sure why.
Yeah, no worries. Other questions? Looks like Jim Perry has a question.
Yeah, Elizabeth, you'll be maybe not entirely surprised, but I studied bus drivers and stress in the Bay Area, and I actually advised the Transport Workers Union in San Francisco. This was back 4 years ago. So, which does sort of indicate that this research has been around a long time. You're looking for that performance connection, but you did make the remark earlier about sort of the cost of burnout and loss of employees. So I don't think you have to sort of fall back, although it certainly reinforces the argument for the importance of this phenomenon. But you could argue that if you're saving $100,000 in your HR budget, that you don't necessarily need to make a performance connection here, or that it doesn't have to lead to diminution of performance as much as it is a cost to the organization. The other suggestion I would make is, clearly one reason people leave jobs is because they don't meet expectations. And one argument I make in this new book is something that's been around also for a while, and that's job previews. But I suspect a lot of people go into teaching and a lot of these other public service professions because of maybe a stereotype attached to the job, but one that is not likely to come true because the job is much more difficult. Matter of fact, I argue in the book that we ought to provide more realistic job previews in order to sort of screen people out. And one reason we lose people is because we don't do a particularly good job of screening people out who maybe don't want to be there for the nature of what public service actually entails. So I'd be looking at that. But I guess the other question I have is, what advice would you have for how do you scale up this learning? Because again, this has been something we've been working on for 40 years. It goes back to the research in the 1970s on the job demands model when it was first introduced. But what advice would you give to public managers in these occupations or in these areas where people may not be getting enough social support or may be disconnecting from the social arrangements around them? Because that's also really sort of an outgrowth of the research. That is, what do we do about this?
Those are all really, really great questions and points, Jim. So I'll start with the first one on turnover. You all heard it here. Jim Perry says it's a good enough outcome. Turnover is good enough, and I don't need to make a link to performance.
There is actually some evidence. This goes back, I think, to an ASQ article in 1980, assessing the cost of turnover and absenteeism. And that's always been sufficient for the private sector. So why shouldn't it be sufficient for the public sector? That is to avoid losing people when you're sort of making hires, because your goal is to keep those people as long as you can.
Yeah, I think that's a really good point. And I say that somewhat jokingly, because actually, if you talk to public managers in prisons, in law enforcement, they are struggling to keep people. The number of vacancies because they can't retain people is a huge human capital crisis. I just feel like oftentimes when I present this work, they're like, yes, but if it doesn't affect performance, then maybe it's fine. One argument that I'm also trying to make beyond what you've already said, Jim, is that firstly, you're right. The cost of turnover, the cost of retraining people, especially in these jobs, is so high that just keeping them for an extra 6 months is a really big deal. The second thing is, for many of these types of professions, we have some evidence that you only get good at your job in your third year, right? Everyone's a bad teacher in their first couple of years. When caseworkers turn over really, really quickly, we know that that's worse for child welfare outcomes. And so maybe there is a kind of performance benefit, not because you're less stressed and therefore you're making fewer mistakes, but we're giving people time because we're retaining them to get good at their jobs and potentially find other coping mechanisms. So again, I don't know if anyone's going to buy that, but I'm going to make the argument and see if people buy it.
Well, related, making that point though, the AC Transit, with which you're familiar in Alameda, Contra Costa counties, used to have problems getting enough bus drivers to drive the buses. And when the bus drivers don't show up for work, the routes don't run, and therefore the service degrades significantly. So that one is directly related to the absentee levels and the loss of staff. So, some of these are pretty close connections.
That's a great example. Yeah, you're absolutely right. You're absolutely right. On the second point on job previews, yeah, that's exactly what I think might be happening. I don't know if it's that we'd be screening. I don't know yet, and I think it's an interesting question. That if we gave people more realistic expectations about what the job entails, if that would work as a screening mechanism, and we just people would drop out earlier in the process, which is great for both sides. Or you might have the same people, but they're just more prepared to kind of expect smaller changes. So I think for me in teaching, this is really clear, right? So if you become a teacher in a public school because you think you're going to save the children, then it turns out you don't save the children, and you burn out and leave because you think you haven't met what impact looks like. That's one story. But imagine if I told you that impact was that you got one student to learn to read that didn't know how to read. Maybe you're then satisfied with your job and you feel self-efficacy and all these things that we think are associated with less stress. So it could just be about kind of rethinking expectations, and it could work as a screening tool, as you note. So yeah, I'd be curious which way that would go. And I think there's a lot of studies to be done that look at that experimentally. And then on your third point about scaling up, one of the reasons I do these types of experiments is because I think they're scalable, highly scalable and highly feasible. They're super low cost. And so since we did this 911 dispatcher project, I've had lots of, firstly, other dispatch centers that they just want the emails so that they can send them out themselves and see what happens. So I think it's relatively easy to scale up. But more importantly, I think the idea is scalable, right? So when I first started thinking about burnout, I was talking to some business school professors not at Berkeley, I should say, at another university. And I was like, we have this really big absenteeism and turnover problem and everyone's burnt out. And their response was like, oh, you could get massage chairs for all the frontline workers. And yeah, exactly. Everybody who is on this call understands why that's a hilarious thought. So I like to test things that are actually feasible in the public sector. And I think this is. So if I'm right, and we've only done one study, so I don't presume that we are right yet, but if I'm right, that creating online asynchronous anonymous opportunities for people to share their experiences has these long-term effects on burnout and retention, then that's relatively easy to set up. In fact, Facebook does this all the time, right? They create professional, or organically, we create professional online asynchronous communities that we use for support, especially in mental health crisis situations like the one that we're living in. So I do think it's very scalable. And what I think it suggests, which is a contribution to that literature that you're talking about, which you're right, has existed since the 70s, is that it's causal. So it's not that people who already are able to make friends at work are also the kinds of people who are more able to manage their stress. What we're doing here is we're connecting otherwise unconnected individuals and finding those results. So that to me is even more promising from a public manager perspective, because you can do it. You can turn on the lever of perceived social support and get the outcomes. It's not just kind of a correlation between two characteristics of less burnt out employees. So I think it's scalable. But again, like with all experiments, and certainly with behavioral science experiments, we're going to have to do tens of these before we believe that this is actually real.
Good, thanks.
All right, Daniel's got his hand up. Daniel?
Yeah, thanks. There's a couple things. One is, and Jim, this popped into my head when you were talking about realistic job previews, and I was just thinking about the challenge oftentimes with RJPs is the deficiency in labor market, creating this sort of structural pressure to sell a job. So, and I suspect in teaching that's particularly true. So there's a tension between realistic job previews and saying, yes, please come join us. Let's convince you to get this job, right? Because of the shortage in teachers. But to go back to my actual original thought and question, and I was just a little late to the game. I had a doctor's appointment. I apologize if you've addressed this, but I'm wondering if you have talked at all or thought at all about negative supportive structures. So when you talk about peer supportive structures, a lot of times people feel support, but the consequences are negative. So there's a sort of cancerous culture, if you will. And so somebody might say, yeah, I feel supported, but that doesn't necessarily mean that it's going to contribute positively toward their feeling of enrichment or belonging, et cetera, if that makes sense.
Yeah, I think those are both really, really interesting points. On the first one, around kind of the trade-off between a realistic job preview and a real need to actually attract more people, I think you're absolutely right. It is an important trade-off. I've done some other work, which I didn't present today, about how to kind of attract people to the public sector in policing, and now we've done some work in other government agencies as well. And I think there's a way to frame the public sector as the place that you go not only to serve, which of course people do, but also because it's hard work and it's challenging, or so that, there's some evidence that can increase applications, or that it's the place that you go to change the system from the inside. And so we're very clear that it's going to take a while and that it's hard and that it's systemic, so that people aren't expecting to make kind of large impacts in a short amount of time. That kind of maintains the realism without causing people to kind of run in the opposite direction. I don't know if that's exactly right, but I think it should be possible to have that trade-off work in a way that at least is clear that this is hard work and attracts new people. And like the Army does this, right? So nobody thinks being a Marine is easy. They've managed to kind of sell it as the kind of thing that is so hard that only elite people do. I think Teach for America did the same thing, right? They made teaching in difficult low-income schools the kind of thing that you have to be really good to be able to do. And so they managed to kind of link a strategy of recruitment to saying this is hard, and only if you can handle the difficulty will you make it. So I think it's possible. On your second point about negative support, I think this is such an important question that I haven't, in any one study, it's really hard to understand the context. So one thing that I think is perfectly reasonable is that in this context, there was like some threshold of positivity that we kind of brought out or nudged out of people that caused a positive environment, and then reduced burnout and reduced resignations. If we imagine an organization or a public sector agency where the kind of threshold level or baseline level of interaction or social interaction is more toxic or more negative, it's possible that this could go in the other direction, where I start telling you that you're valuable and you're valued, and you say, yeah, you're right, I'm valuable and I'm valued, I should leave this terrible job. And we see like a really high increase in people quitting, at least early on. I don't know exactly, and I'd love your thoughts, Daniel, on how to measure that, like how to measure what negative social support would look like. But I certainly think it's possible that it's there, and I think it's very context specific.
Yeah, I guess I think if there's a way to ascertain the kind of interaction that people have with their peers, could tell us a lot. So if it's like, teachers in the break room talking about, how they work, 2,700 hours a year, but get paid like they work 1,200 hours a year or something like that, or whatever it might be, or they don't get support from their administration, or they're fighting with the parents who are over-involved and struggling with the parents who are under-involved, or whatever it is that they use. I mean, getting an idea of the nature of the kind of things that they receive support about might give some clues to that. I worked actually in a municipality, and we had a real problem with turnover in a 911 center. And the first thing I said, I was the head of HR, and the first thing I said to the person who was in charge of the dispatch center was, if you want to save money, you need to hire more people, which he looked at me like I was crazy. But the burnout in that organization was coming from the fact that they were understaffed and overworked and always on call and never getting to what they were doing, et cetera. And so we actually added 3 positions out of, I think there were 24 at the time or something, and it greatly reduced our burnout and therefore turnover. so the staff felt undersupported because they were understaffed. And it also had a dramatic effect on their day-to-day lives as well in terms of their time.
Yeah, that's super interesting. Dispatchers, like correctional officers, there's some parts of the public sector that someone has to be on call 24/7. And so if you already are in a cycle with high absenteeism, the person who's already there on the floor has to do another 8-hour shift, which is bonkers if you think about it. And so you're absolutely right that just adding in some more resources could improve costs as well. One thing that I didn't mention is that we can see what people say. So you gave me a good idea, Daniel, to kind of take a look at what people share and see if there's kind of a systematic way to separate out people who say things like, this is really hard, but we're all in it together and what we do matters, versus people who say, the leadership clearly has failed us. This job is terrible. I'm only waiting until I find my next job. We see a little bit of both, but it'll be interesting to see kind of how that predicts future outcomes. And in one of my current field experiments, we are seeing that. We have two professions. I wish I could share more, where one of them are saying the kinds of things that I expect. Like, I wish, society understood how hard our work is and how traumatic it is. And another profession is saying, all our coworkers are awful and they are completely arrogant when they interact with us and they don't understand what we do and the leadership is awful. And so maybe we're going to see divergent effects on burnout with these two populations. And we give them both the same opportunities to kind of share their experiences. So I'll let you know how that goes. I'm very worried about it.
Sounds like nurses on the second group, Elizabeth.
Nurses often feel not respected by other people in their work environments. We'll stop there before I get myself in trouble.
We have another question from Cynthia, who wanted me to clarify. She's not asking them herself because she has screaming toddlers in the background. But Cynthia had asked something I thought about during the presentation, and she was wondering if you were seeing any differences in the influence of social support for different socio-demographic groups in your data. Specifically, does social support have stronger effects for women versus men, or women of color versus white women, et cetera?
Yeah, it's a really good question. And Cynthia, I feel the screaming toddler. It's always very bizarre when I work on burnout and I have my own screaming toddlers here being like, we should talk about work-life balance. So your screaming toddlers are welcome to the conversation is all I have to say on that. The question that you ask, I think, is really interesting, and I'm bummed that my sample is basically not big enough to be able to give you a good answer on heterogeneous effects. Theoretically, if I'm right that this is about affirming belonging, then there's a really large literature on belonging uncertainty that suggests that this should have larger effects for people who traditionally don't feel like they belong. So that could be people of color, it could be women, but it also could be men, right? So in some professions that are dominated by women, it could be men that don't feel like they belong, when teaching or nursing, for example. So I'm hoping to look at that in future research, but just to give you a preview, in the COVID studies that I mentioned, that first study, which is just correlational, we do see a much larger effect of belonging uncertainty on people of color, on people who are financially more insecure. So these are, city employees that are facing furloughs and other things during this period. And so it's possible that your intuition is right, and it certainly matches my intuition. I just don't, my sample's too small to be able to kind of put the data in that many ways.
Excellent, thank you. Do we have any other questions? Any other questions from the crowd?
Yeah, I have a quick question. I was wondering if you could talk a little bit about how you disentangle perceived versus received social support. I'm having some trouble with that concept, just because it seems like they would maybe feed into each other, right? So if you get perceived social support, maybe that counts as received, or vice versa. And so I'm curious if you are very firm about your categorization that horizontal peer social support is perceived rather than received, and why you would make that argument.
Yeah, Emily, that's a really good point. So you're absolutely right that in the wild, in real workplaces, or even in our social relationships outside of work, chances are those things are highly conflated, right? So I help a friend out, or a neighbor helps me, and that's received social support. And that in round 2 makes me feel like I have someone to turn to if I need them. And so there's a cycle of perceived and received social support. And that's part of the reason why the literature on social support and burnout has been so mixed, right? Because if you're just measuring it, right, in a cross-sectional survey, you're probably capturing both. There's some research that tries to disentangle it in the correlational work, but like you, my sense is that it's too conflated in substance to be able to disentangle econometrically. What I mean in kind of my description here is really kind of from an implementation perspective. So in the world of kind of burnout, employee engagement, mental health supports, oftentimes public managers set up systems for really direct receive social support. So in healthcare, for example, it's trendy to have like a balance group, which is like you may know these, groups of nurses or doctors who come together, like a group therapy thing. You sit down, you talk about your problems, you give each other advice. Many peer support programs in law enforcement are also based on received social support. So like an incident happens, and then somebody calls you from the peer support program and talks to you about how you're doing and checks in on you and tries to offer you emotional support. So what I was trying to say is like, let's try not doing that. And let's try pulling a different lever, not because I don't think it's going to affect perceived social support, but let's pull the lever of perceived social support. So in this setup, they don't actually ever directly interact with each other, right? They're sharing their experiences on a platform. They can read other people's experiences, but partly for technical reasons, they're not giving each other advice or responding to each other's comments or asking for advice in a kind of more organic way. So in that sense, what I think I can argue is that I'm only causally impacting perceived social support. And in real life, that might also cause changes in received social support. But I think it's interesting to, even from an implementation perspective, that we can get away with just affecting perceived social support without actually having direct interaction. So that's kind of how I'm thinking about it. But I'm glad you brought that up, because I certainly wasn't clear about that when I described it.
Excellent. All right. Any other questions?
I have a question about about just like measuring, how you think about measuring burnout broadly, but also specifically in your first study, I remember you said that you use different measures of like psychological distress, like anxiety and whatnot. And so, I would imagine with job burnout, like that's very clear that we want job burnout to go down. But with a measure like anxiety or I think it was secondary trauma, is it, how do you think about that? Because I know like right now, like positive psychology is really in, and like building grit, and then thus like lowering your anxiety is the sort of like popular, like, and also low cost intervention. But at the same time, like, I don't know, there's probably other problems that come with like a 911 responder. Probably it would be weird almost if they didn't have high anxiety at the job. And so I'm curious how you think about that.
Yeah, it's such a good question. So measuring this stuff is the bane of my existence. So I can give you my thoughts on it. But I'm very upset that we don't all have better measures for these things. So we have some really strong validated scales that have been used for a very long time of just burnout. The CBI is one. The more common one is actually the Maslach burnout inventory created by Christina Maslach that has been used for 4 decades now. That tries to disentangle 3 dimensions of burnout quite well. One of which is this emotional exhaustion idea. The second is depersonalization. And then the third is personal accomplishment, or this idea of self-efficacy. What's interesting is that there's probably some, to your point, Sean, there's some U-shaped pattern where one way of coping with a lot of trauma is to kind of disassociate from the clients. That's the only way you survive. Some people will call it cynicism, but you can imagine that like disassociating completely might actually be bad in some form for service delivery. So think about, and this is again a stereotype, but think about the story of, a caseworker that like just doesn't feel any empathy towards the children that they are in charge with for a child welfare case. Like you can imagine that causes a lot of problems. So one thing that I've been thinking about is should we be thinking about kind of employee engagement and burnout as two opposite sides of the same coin, or is burnout the extension of just being too passionate or too empathetic or kind of too engaged with your work? And there's some good research on both sides. I don't think it's super clear. On anxiety, it's a good question. I guess my prior would be that your ideal 911 dispatcher maintains empathy, but doesn't get anxious about every call. If we think that anxiety has all these other negative benefits, or these negative consequences, excuse me. But certainly separating out kind of anxiety and short-term stress from chronic stress, which is what burnout is, would be really interesting, right? So maybe we need a little bit of adrenaline to get the firefighter to the house quickly. That's a very bad description of what 911 dispatchers do. But maybe we need some level of kind of really caring about the outcome that causes some level of stress. And there's a lot of Harvard Business Review type articles about how like, it's good to be stressed and you just reframe it as excitement and then it's good. But the levels that we've seen in the public sector, I think, are so high that I think we're really far from that point. So I think you're right that at some point it would a little bit more stress might be good, but I think we're at the levels of burnout in the public sector, at least for frontline workers, that reducing anxiety can only be a good thing at this point. But again, I'm just saying that. I don't know if that's in fact.
Excellent, Sean. Does that answer your question?
Yeah, that's really interesting. Thank you.
Great. Do we have other questions from anyone? Elizabeth, I have a quick question, and maybe we can sort of wrap it up a little early, but I wanted to ask you if you could follow up on the idea that you said for future research, looking at how this is impacting decision-making. What specifically were you referring to? Are you talking about the individual frontline workers' decision-making, or are you thinking more about organizational decision-making? Because I can see that being a much more difficult sort of design to get at, but one that is really interesting, and potentially, if we think about frontline workers as sort of these information conduits, to supervisors and sort of middle managers and upper management decision making, if that's what you were referring to try to get at.
I was not referring to that, but that is far more interesting than what I was saying. So I'm writing it down. That's a really cool idea, which I haven't spent much time thinking about, which is how do we think about kind of the street level bureaucrat providing information up. And how their burnout or their reduction in burnout then affects their ability to share information up. That's super interesting. And I have nothing interesting to say on it right now, but I'll think about it and get back to you. What I'm currently looking at is really kind of frontline worker decision-making as well. So in corrections, for example, wouldn't it be great if I could reduce burnout in correctional officers and that reduced use of force against inmates? Wouldn't that be nice if that were true? Wouldn't it be great if I reduced burnout in police officers and that reduced discriminatory arrests because now they have more cognitive bandwidth? So if you think about in behavioral science, kind of the broader scarcity literature that says, if I am in a scarcity mindset, I'm less able to make less biased decisions. I think of burnout as something that takes up a bunch of cognitive load. And so if I can reduce that cognitive weight, maybe we can also just make better decisions. I haven't had a lot of luck making that work, but maybe there's kind of a pathway there. There's a little bit more broad. So for example, and this is related to Sean's point, maybe if I reduce burnout, then people have more energy is the wrong word, but just have more resources for things like extra role performance. So for example, in nurses, I'm really interested in kind of what reduces bed sores or what reduces infection rates that are really about whether or not you're willing to do a little bit more, a little bit extra as part of your work to make sure that a patient is comfortable and moved and things like that. So maybe there's a pathway, a causal pathway between reduction in burnout and extra role performance that has effects on decision making more broadly. It turns out it's really hard to get that causal pathway right in a lot of public sector environments for all the reasons that I don't need to explain to this crowd, which is that there are very few decisions, real, observable, measurable decisions in government that are made by one person. So in my dream scenario, I would reduce burnout of a social worker, and then showed changes to whether or not a child is removed from a home, or the disparities in which children are removed from homes. But like 12 people are involved in that decision. So it's really hard to do that at the individual level. So we're thinking about designs to try to get at that, that are more clustered. And it's at this point kind of this is like not the fun part of what we do, but it's just a sample size problem. But that's how I was thinking about it. But I will now spend more time thinking about what you suggested, which is looking at organizational decision making, because that's fascinating.
Yeah, well, thank you. It's very interesting. I don't have anything more insightful to say about it either, because it just occurred to me. But several steps down the road, perhaps, getting
Sure.
to that. So if we don't have any other questions, I think we could all go ahead and wrap up and preserve some of our own Zoom mental bandwidth. I want to thank you again, Professor Linos, for sharing the wonderful research with us. It was very insightful, and I'm sure we all got something out of it. And thank you again for taking the time.
Thank you for having me, and thank you for the really great questions. I've taken lots of notes.
Excellent. All right. Well, see you all later. Thank you.
Have a great day. Take care. Bye.